21 H1n1 deaths across the state of Iowa, 7 here in Polk County, and tonight we're learning there actually could be several more.
We're now seeing, though, a virus that may cause more deaths than we're used to in this country.
Good evening, and every day we are learning new details about the victims.
News Channel 8's Katie Ward has our top story.
The Polk County Medical Examiner says he has performed autopsies on several Polk County residents that were never diagnosed with H1n1, but actually had it.
In the autopsy, what we're seeing is very heavy, wet, hemorrhagic lungs with a lot of blood in them.
Dr. Gregory Schmunk says the 7 H1n1 deaths in Polk County is not an accurate number. He says there have been several more, though patient rights laws prohibit him from giving specific numbers. He says there are a few reasons for the discrepancy. One, not all sick patients are tested, and the virus is difficult to detect. The most accurate test can be too invasive for the sickest patients.
That's not always done, and it can be hazardous to the patient if they're in a respiratory critical situation.
Finally, some tests reveal a false negative.
Because of our limitations on testing, sometimes the tests aren't positive, but they do appear to fit clinically the course of an H1n1 viral type pneumonia.
He says the cases he's seen in Polk County were all middle-aged adults with one of two things, diabetes or...
These may be the patients that are obese, and so obesity restricts your ability to breathe and clear maybe the virus from your upper respiratory tract.
His message, get the vaccine.
The thing that concerns me the most is you still have people out there that are believers that, if I get the vaccine, if I get the shot, I'm going to get the flu. Well, you can't get the flu from the shot.
In the meantime, some good advice. Remember to wash your hands, sneeze into your sleeve, and stay home if you're sick. Here's a statistic. The Centers for Disease Control says that one person who goes to work sick with the virus will infect 10% of their coworkers.
Wow.
It's a pretty big number.
It sure is. Thank you, Katie.